Hi, everyone. Welcome back to Mind What Matters. Today, we are finally back. Thank you for being patient with us while Nikki is traveling. And last couple of weeks that we re-released old podcasts, the feedback's been really great. I'm happy that our caregiver stories from the past have really landed with you guys and that you found meaning in them. It was really fun for me to go back and re-listen to how this whole podcast got started in the first place. So thanks for being patient. We actually have a guest today. I am still down my co-host. She is still filming in Greece. We miss her. So we love you, Nikki, and we hope you are just killing it out there filming your next movie. But this morning, I think you guys are really going to like the direction that this podcast is going in today. I know we obviously spend a lot of time talking about Alzheimer's and caregiving, but one of the things Nikki and I chose to do when we sort of restarted the podcast was to talk about all things caregiving. There are so many different types of caregivers out there, especially ones that are long-term and long-lasting, things that go on for a decade or more that doesn't just exist for Alzheimer's and ALS and Parkinson's. There's all kinds of other disorders and disease that cause parents, grandparents, brothers, sisters to care for loved ones for a long period of time. And one of those is all of the neurodevelopmental disorders that can occur in kids. We're sort of talking about autism, dyslexia, ADHD, and there's such a spectrum of, they call it the autism spectrum for a reason. And it is that. It is such a long and wide and vast spectrum. And so I wanted to get somebody on the podcast who really knew what they were talking about. About 3 to 4 months ago, it came time for one of my kids to redo a psych ed. They have ADHD, and every 3 years, in order to get services at school, you have to redo this testing. And this woman came so highly recommended to me and my family. She was actually there was an old friend of mine from Memphis where Hunter and I were married and started our lives that had moved to Nashville. And she said, you have to call her. She's incredible. She moved here from Memphis several years ago, and she is basically just the best in her field. She said everybody drives up from Memphis still to see her because she's so good at what she does in diagnosing kids and helping families get the support that they need. So long story short, I did. I kind of jumped off the bridge and we went with somebody totally new. And when I tell you that Hunter and I's brains were just like blown by the amount of knowledge and compassion this doctor had for one of our kids. And I literally decided to have my other kid who had nothing going on tested just because I wanted a baseline for where he was in school. He was like struggling a little bit in math and had some anxiety around that. And so all I can say is she took such great care of my family. She knows what she's talking about more than any other psychologist, psychiatrist that I've ever talked to about anybody with kids with neurodevelopmental disorders. And I think that there's so many directions that our conversation can go in. And we talked a little bit last night about how to steer it because there's just so much information out there that needs addressing. There's a lot of families that are struggling through diagnoses like autism, like dyslexia, like ADHD. And I don't think the general public really understands how complex some of those issues are. So I'm going to read Dr. Richie's bio, and then we are going to welcome her into the podcast. Dr. Richie is a summa cum laude and Phi Beta Kappa graduate of Millsaps College. She was one of 6 students accepted to the PhD clinical psychology program at Ole Miss and completed 2 postdoctoral fellowships, including a 2-year fellowship in clinical neuropsychology at Le Bonheur UT Neuroscience Institute in Memphis. She started her private practice in Memphis in 2010 and now practices in Brentwood, Tennessee. That's Nashville, guys. Dr. Richie has performed 3,500 neuropsychological evaluations, given over 100 presentations, and published research and a book chapter. She served as an adjunct professor at Ole Miss for 4 years and has been an assistant professor in pediatrics at UT Health Science Center since 2009. She's been honored as one of Memphis Business Journal's top 40 under 40 and St. Jude Children's Research Hospital Women of Distinction. She is a board member of Best Buddies Tennessee and the International Dyslexia Association's Tennessee branch. Dr. Richie is passionate about helping individuals with neurodevelopmental disorders feel understood and families find clarity as they navigate their next steps. Welcome, Dr. Richie. Thank you for being here. Welcome to our podcast.
I'm so happy to be here and share whatever anybody wants to hear that I have to say, honestly.
Well, that's a large task because there's a lot inside your brain. And guys, by the way, she has the most adorable Southern accent I have ever heard. I lived in Memphis for the longest time. I went to college there. Hunter and I started our life there. And when I tell you, like the minute I met you, I was like, oh gosh, that is Memphis. Like it's such a distinct accent. And I loved it. I loved hearing it again so much. In fact, when I came home after being with you, my oldest was like, Mom, you have so been talking to somebody from Memphis. He's like, I can hear it coming back out.
I call it Tennessee because I grew up in small town Mississippi and then I did everything at Ole Miss and then in Memphis. So everybody in Memphis pretty much knows everybody in Mississippi, I think. So I call it
Yeah.
Tennessee. And then I say, you can be smart and Southern. So people try to train this out of you. And I'm like, I don't need to train anything out of me. You can understand what
No.
I'm saying, I think.
Are you kidding? I love it. And I love that you talk fast too, because that speaks to the Yankee inside my heart. Cause like I have a tendency to speak too fast. My dad can't even understand me. He'll be like, slow down. I can't hear you.
I have
Like
heard that that is the one thing that makes me non-Southern. But I think, you think fast, talk fast, you listen fast. If you need me to repeat something, I totally will.
I think it's you talk so fast because you're so freaking smart and there's so
Oh,
much inside your brain. It's like, it is unnerving. I will say, like, for somebody who loves to hear medical knowledge and like learn, like when I was in your office, I was just like, I'm trying to keep up with everything that you're
ah!
saying right now, and I can't. And I so desperately want to know it all. Like, just put your brain inside mine, and that would be great.
I will
But
try.
no,
There's that.
I'm so happy that you were on our podcast and that you were sharing time with us. I'm going to jump right in.
Yeah.
So, guys, obviously what we're talking about today is such an important topic, and it's also one that we haven't really talked about on this podcast at all. But caregiving for someone with a long-standing neurodevelopmental disorder can be one of the hardest things in your life. And I'll be honest, I have 3 kids and I think they're all like just, I don't want to say neurotypical. Like I think we all, every single person in my family has got just a little bit of extra, and it makes life harder. It just does. It makes it richer. It makes it more beautiful. It makes it more creative and more fun, but it definitely can also make it more chaotic and sometimes highly emotional. And I am just very thankful that I found you. And I have about 812,000 questions I'm going to ask. So let's just get started. First
Jump
thing
in.
I want to ask you, why did you get into this field? It's very specialized. So tell me, explain why, you wanted to do this.
I think my original experience at Millsap College, my senior year, they had the first neuroscience professor come in, and he invited me to be part of his neuroscience lab. And we paired up with a medical school at Ole Miss, which is University of Mississippi Medical Center. It's in Jackson, Mississippi. And so we were able to participate in research, and it was cytokine research for cancer patients and figuring out how we could enhance their ability to feel hungry and figuring out the mechanisms contributing to that. Then I
Okay.
thought that a lot of that is brain based anyway. So they're trying to manipulate things that the processes in the brain that are tricking someone to thinking that they're hungry so they can maintain nutrition. Then fast forward to clinical psych program at Ole Miss and starting to do these assessments and figuring out these people possibly have been treated for the wrong thing, or it's just the aftermath of the actual factorial contribution of, hey, this was autism, not just ADHD, or it's the comorbidity of autism and ADHD and dysgraphia. If you look at it more holistically, and I think assessments are the way to do that, you're actually able to see all the contributors, not just what you think it is on the surface. And so inevitably that led me to seeking out internships and fellowships that were obviously required for being licensed, but then navigating that initially toward the Memphis VA. And that's when I was in the traumatic brain injury and geriatrics divisions. And so I saw a lot of dementia. I saw a lot of Parkinson's, movement disorders. I saw a lot of kind of status post injury where you didn't have any of these problems before you had a traumatic brain injury and now you do. So acquired injuries and just seeing all the things that the brain is responsible for and being able to dissect, so to speak, with lengthy testing. It's a lengthy battery of tests, but you just look at everything that the brain is supposed to be doing. And honestly, Liz, it was fascinating. And I've never felt anything other than this is fascinating. And the people now that come into my office, I started my private practice in 2010, and I've never had a dull moment, honestly. I've never been kind of disappointed in the way that I hear things being described, and then I can maybe help people change the narrative and say,
Mhm.
well, what looks like defiant behavior is actually something that's a frustration from a learning disability or
Mhm.
ADHD and the related limbic system that gets ignited and you have less control over your volitional behavior. So I
Yeah.
think a lot of that is more of that navigational road that I think that I'm able to provide, but it all comes down to listening to my patients and their families. And I
Yeah.
think that that's really, a gift that I've been given and to fuel my passion for doing what I do, but also recognizing that you're supporting a whole family unit in the process, not just that one individual. So, long story made short, it's like the passion that came from seeing how I could be of service and the ways that assessments really do solve some of the questions, answer some of the questions that you kind of didn't know the answers to beforehand.
And I think that what you just said is such a perfect segue for my next question. I think when any family finds themselves with a child where you just know, okay, they're struggling and we don't know why. And that could be anything from, they're coming to you angry every night because they don't want to do their reading at bedtime,
Yeah.
that's required for, let's say, kindergarten through fourth grade, or they don't want to do their homework, or they don't want to do their math homework specifically. And you see these like behaviors start to arise where you're like, wait a second, something isn't right here. Why are they being so resistant? And particularly if you've had, kind of the more neurotypical child that doesn't struggle at all, maybe that alarm bell goes off a bit sooner. But especially if it's your first child and you just don't know any different.
Yeah.
But all of a sudden the teachers start saying something and they're like, well, your child is struggling here or your child is struggling there. And we really think it's time that you pursue some outside testing to quote unquote see what's going on. And I use that phrase because I've had it told to me, and there are no more just fearful words out there to a parent when a teacher takes you aside and says, "I'm not really sure what this is, but I think that we need to explore it deeper and let's see what's happening."
Yeah.
And that's the moment that most people enter your office.
Yeah.
They're scared, they don't know what's happening, and more importantly, they don't know the future and they don't know how to um, plan for it or really prepare for the coming years for their child. So, will you talk a little bit about like the most common things you see in terms of patterns? And that can be everything from, warning signs of dyslexia, warning signs of ADHD, warning signs of learning disabilities, and even autism. Like, let's just go through the whole list because I think for people who are listening out there, and maybe they have a kid like this, maybe they have a kid that puts up a huge fight about homework or they're expressing anxiety over having to go to school. And that kind of came overnight. And you're not thinking, okay, well, they have friends. It's not that they're being bullied.
Yeah.
Why are they not liking school? There's just so many different things I think that can land a parent in your office, but let's just talk through a few of them and maybe what some of the symptoms are in those kids.
Yeah, yeah. I think starting with autism, probably just because I do see a lot of dyslexia, dysgraphia, ADHD, and autism spectrum. So
Okay.
I think that that would probably be the list that I see the most of. But those are also the most pressing for success in school and success in social relationships. And I'll say, Liz, like you get to a point where these things start to appear, but they've already had some precursors before. You're just kind of putting all the data points together to say it's now gotten to a point where I can't explain it from, oh, he's just 7. Oh, he's just a first grader. And so, for instance, for autism spectrum, it truly is a spectrum, like you said. And when I did Memphis 40 under 40, they ask you who it is that you would most like to meet, and I said Donald Gray Triplet, and everybody's like, "Who is that?" Well, he was autism's first child. And so he was born in Forest, Mississippi, and he presented with the classic symptoms of autism, which, this social isolation, but fixations on things. So his fixations were mathematics. He, I think, was able to recite Psalm 23 by the time he was 2. Just amazing. Yeah, amazing memory, amazing intellectual potential, but couldn't operate in the way that we expected. And this is in the 40s. And so took him, locally, and they're like, you need to institutionalize this child. He's never going to, be independent. You need to just kind of shelter him from the world that will make fun of him. So luckily his family had enough resources to take him to Johns Hopkins, and he got into the autism clinic there. Dr. Connor was the psychologist there. And it was the first diagnosis of that he was the autism's first child. There's a documentary about it. And so when you look to see the spectrum, he would be on kind of the lower end of the spectrum, level 3 or level 2. But then when you get therapies, you start to enhance your ability to recognize social cues, to recognize language pragmatics, how you're using your vocabulary to functionally and socially communicate. You start to build these skills. And don't you know it, he ended up at my college, Millsaps College. He graduated with mathematics and French degrees. He was able to go back to Forest. His family was part owner of a bank or whatever, and worked there in accounting for 60 something years. And so you just see those stories to say that what you think is someone's path is not necessarily their path, especially now that the internet exists. We can all share stories. You start to see, oh, this family is talking about these symptoms. That kind of sounds like my kid. Well, now that he's in middle school, I'm seeing more and more and more of it. And so what we see is that over time, the expectations for what constitutes a reciprocally rewarding relationship, what constitutes that in fifth grade, is so much different than in kindergarten, first grade. You have a lot of leeway. Kids are very forgiving early on. And now in fifth grade, when you have more control over who you're going to play with on the playground or who you're going to invite to your birthday parties, if you have some of those difficulties recognizing social cues, or you're constantly talking about the same thing, like you can't get off Minecraft or whatever it might be, which is entertaining for a little bit, but you can't shift away, that's when you start to see some of the mood stuff come in, the social anxiety stuff come in, and you didn't see that before, but that child is getting a different reaction than they did in the first grade and second grade, whatever it is. It was still there. It just manifested to the point where you're recognizing, hey, there's a gap here. And I
Right.
think the beauty of it these days is that people are not, typically in my world, because they come, they're not afraid to discuss it at least. It's fearful to say what it might be because a lot of times you've already let Dr. Google tell you all of these things that it may be. But when you start to really understand that this is the constellation of symptoms that's on a spectrum, and just because you might start at level 2, which means that you do need intensive speech language therapy or occupational therapy for the dysgraphia piece or the fine motor piece that often accompanies, or ADHD treatment, when you're starting to see that there is light at the end of the tunnel, but we have to go through these steps to get there, I think that's what resonates with most people. So when I see a family initially, they have an idea about what this might be, but they need the confirmation. And I think one of the most useful pieces of my work is to just listen and ask the right questions to figure out the two categories of autism spectrum. Where do we fit in here? The restricted interest, the repetitive behaviors, the fixations, the insistence upon sameness, the difficulty transitioning. That's one category that is really honestly not explained by any other neurodevelopmental disorder.
Mm.
That is the one piece that we
Right. You
really,
got to have that.
yeah, and it looks different for different people. I think the common phrase is you've met one Aspie, you've met one Aspie. And that's when we used to diagnose Asperger's disorder, autistic disorder, and PDD-NOS. Now it's autism spectrum disorder level 1, 2, and 3, which is a lot more helpful, I think, because previously with Asperger's, it was like, did they have a language delay? And sometimes I'm talking to parents that have 5 children, and I'm talking to them about their youngest or their oldest, and they can't remember, exactly when someone spoke. And to have the diagnostic criteria be a little bit more friendly to say that it's a spectrum. You might exhibit more restricted interest with regard to your interests, but you don't have a difficult time transitioning from science to social studies. We have to ask all of those questions to see what does it look like in this category. The other category is the social interaction and the language and the communication piece of that. And I think the most common misconception is that people on the spectrum don't communicate, or they don't initiate conversation, or they are not interested in having those interactions from a verbal standpoint.
Or that they can't be empathetic.
Yeah. Oh, yeah. Absolutely.
Yeah.
I just finished a report last week on the sweetest girl who cares for the teacher's needs.
Mm.
So she struggles with social interaction, and we're working on that. So we have a social skills therapist, we have a speech language pathologist, and the teachers are on board. So she goes to a wonderful school where they also have a social communication group where they pull some of the same, typically developing kids and kids that have these problems. And so they work on social communication skills, and the kids just think they're playing games, but it's active going on in the school. And so then they share that information with the teachers to say, hey, this is the verbiage that we have been using with these children. Please continue this on for generalizability. Because just because you're in a room for 30 minutes in those four walls, it doesn't mean that a child can generalize all of that to the real world.
Right.
And so it's a very collaborative, intentional effort on everybody's part. But her heart, trying to help the teacher, bringing her peppermint, just she wants to be with the teacher. We want her to branch out to be with, the children too. But just her love for that teacher, and she knows that teacher is for her. It's such a big heart and an awareness of how you care for people. So
Right.
yes, the misconception is that I don't care, I don't want it, I want to isolate myself. I mean, I have had patients who occasionally have their interests are on computer, and I think to myself, they are developing servers for their home HVAC system. I couldn't even press the button to start that process. And
No.
I'm like, this is such a unique talent that this
Yeah.
child has. Who am I to say that they're supposed to be playing outside the whole time? Like, let them develop these talents, because most likely they will be developing an app to solve, carbon emissions,
Yeah.
problems. So there is a lot of gray area there to say what is, working, and is what is not working, what we should do, what we shouldn't do. And I think, research only takes you so far. I take research with a grain of salt, and I'm grateful for the people that study these things, but how it looks in the real world can be a whole nother animal. So
Right.
and the kid, in my opinion, is their best baseline. And then you bring family dynamics into it. So I'm asking these parents to sign up for probably 2 days a week of speech language therapy, and then occupational therapy once a week, and then some sort of social skills therapy, and then family therapy with a behavior specialist. And they've got 3 other kids.
Mhm.
So my
That's so much.
it
That's
is
so much.
so much. And then when you talk about the caregiver role, especially with the sandwich generation, and now there's the club sandwich generation,
Okay, you have to describe what that is. I had when we first talked and you used that phrase, I mean, yes, are you kidding? The sandwich generation, that, like, I probably hear it 3 times a day, but I have never heard club sandwich, so explain what that is.
that is, to my understanding, because I'm not in it, but it's the caregiver, the primary caregiver who has an adult child with a neurodevelopmental disorder, or, a child with a neurodevelopmental disorder, because, people are having kids later and they have a range of ages for their children, which wonderful. I support. And so you have someone with a need, and if it is an adult with autism who is full time care, and
Mhm.
you're caring for your mom or your dad who has either a movement disorder or dementia of some type, and you have a grandchild who needs you to pick them up from school, or who also starts to show a language delay, and the parents are both working, and so somebody needs to take that kid to the speech language pathologist after school. There are just so many demands and not enough hours in the day. And I understand the demand, and I always say, do what you can. You are a real family. We can do what we can to get the school to do what they can, but at the end of the day, we can continue getting services. It's not a make or break situation. We really need to get in there intensively, but you also have to maintain a positive family dynamic best you can. So the club sandwich generation is all of those generations.
Okay, so yeah, so just to recap, from what I'm hearing you say, like, club sandwich is you're caring for an aging parent, you're
Yes.
caring for your children still, maybe a child, and you're also taking responsibility for the care of a grandchild,
Yes.
or at least partial care.
Yes.
That is a tremendous amount of care, and it's also sounding to me more like, the longer our parents live, And the later that we're having children, the higher chance that there is that you're really going to be caregiving across your lifespan
Yep.
once you become an adult. Like it doesn't really stop. It used to be, your parents get to be in their 70s, you're in your 40s, you take care of your parent, they die, that's kind of it.
Yep.
But now we have this multi-generational caregiving happening. And what it's doing, in my opinion, is it's putting a level of pressure on like a nuclear family that has never been there before.
Right.
Um, I think that one of the hardest things for people to understand about all of these developmental disorders is that when you have a child who has something extra going on, and nobody's really seeing what's happening behind the scenes in your own home, it's easy to just assume, oh, they're just a little free spirited, or oh, they just have a little ADHD, or, they're just a little hyperactive. But can you explain a little bit about like what that actually looks like behind the scenes in the family and the types of things that those families are dealing with and trying to emotionally regulate all the time?
Yeah. And I think that BCBAs are worth their weight in gold, a board certified behavior analyst, especially for autism spectrum, but they also see some of my ADHD kids. And just saying from the perspective of you may be masking this at school and you've kept it together all day at school.
Mhm.
Then you come home and it's your loving environment and you hurt the ones you love the most, so to speak, and you feel like you can let it all out and nobody is seeing this. But what was the precipitating factor? I'm having trouble at school. I'm having trouble in whatever way I'm having trouble. And so for behavior specialists, what they would describe is the ABCs of the way that we interact with our world. So we always know the behavior that we want to change. So when you're at home and someone has this emotional outburst over something so benign in our world, but that limbic system got ignited and it was fight or flight or freeze mode in that moment. And you're thinking to yourself, what did I say? Or what could I have done differently? Because what I just said to this child didn't land that way on this child. So, for
Mhm.
example, people with ADHD, now we know there are two kind of behavioral manifestations. There's rejection sensitive dysphoria, and that is that people with ADHD, and it's for autism spectrum too, is that they might feel emotions so much more strongly or feel the sense of rejection either true or not true. It's the perception of what they feel. And if they feel the rejection, it is just kind of DEFCON 1 at that point, instead of that, hey, oh, that didn't feel good. What can I do to do something differently next time so I don't get that negative feedback? It's very difficult for them to sit with the negative emotion and they either internalize it, I mean, in a distressing way sometimes, or the deficient emotional self regulation, which is the DESR, is more of the externalization of that. And you can keep a lot of that at bay because you know it's socially inappropriate to do that at school or in a group of people. But at home, it can feel like a war zone sometimes. And I think it's so validating to parents to listen to all of that. I sometimes don't see that in my world because they're on the best behavior. I get the honeymoon period sometimes, but
Mhm.
it doesn't invalidate what parents are telling me are happening, what the behaviors are at home. So if you go back to what a BCBA would say, it's the behavior, and we don't always know the consequence, the C part of it. We try our best. Punishment doesn't always work because the
Right.
intent was not to disobey. The intent was not to come at you. The intent was somehow I need to feel better about this. And I have struggled with regulating my emotions all day. So you just happen to be kind of
The
my
person
sounding
who got
board.
it.
And it stinks. But, some people would say it's better to do at home than at public. But I don't think it's great really anywhere because it's the struggle. It's the internalization and that's that cardiovascular ignition too. It's getting ignited. And so the behavior specialists look at it from a different way. The behavior and the consequence, yes, but the antecedent is really what we want to see. What is it that's the precipitating factor before the behavior? Because that's really where you want to hit it.
That's what you have to change,
Yes.
right?
And so if it
It's
were,
so hard it's so hard for
Mhm.
the kids too,
Yeah,
like, I had this little thing with Gaines earlier, my youngest, much earlier in the school year. He came home from school, he was just tired, and he didn't wanna go to soccer practice, and I was like, "I mean, you joined a team, like, we're pretty strict on that, like, if you've made a commitment, you gotta keep up with it." And, I was, like, forcing him basically to go get dressed, and he was just pitching a fit, I mean, almost like a three-year-old, and he was just like, "I don't wanna go, you can't make me," and I'm like, how old are you? He was only 9 at the time. He's 10 now, but I was like, this is not okay. Like what is actually going on here? And I kind of just left him to his own devices to cool off. I was like, you need to cool off. Like go to your room, like get your clothes on, but like you need to take a beat. And when we were in the car, I was watching his face and I just looked over at him and I was like, are you feeling embarrassed? Because I could tell he had calmed down. And I said, are you feeling embarrassed right now? And he just kind of like nodded his head. And I was like, you don't need to feel embarrassed. I was like, you're tired. You're exhausted. You didn't want to do this. And you've kind of, you had in a little outburst, but I was like, it's okay. I said, it's okay to do that. It's okay to have big emotions. It's okay to feel deeply, but now we need to talk about it and like what really led up to that,
Right.
and then come to find out he had struggled in math that day and he felt bad about himself and he was worried about having to go back to school the next day. And when I compounded that with like, oh, by the way, now go do another structured
Yeah.
activity, little brain just went, I
Yep.
can't handle this.
Exactly.
And I think that's what happens with so many kids, but the parents who don't um, they try and parent that out of them or they try and discipline them. That's where the real injustice to me happens, is because you're just trying to force a child to self-regulate when they don't have the tools otherwise needed to do so. And you're not showing them a way, you're not modeling for them a way to learn to calm down and to learn to cope. And that's where the specialists can come in and really just be so effective. I mean, am I right on that?
Absolutely, because the self-shaming aspect of that is not what we want to perpetuate. It's more of that, let's have open communication. If there is something that you need to tell me about what's going on at school, this would have kind of offset that path to whatever that emotional dysregulation was. And that's again what we're talking about, is looking from an assessment standpoint. Is there something, you know, diagnostically going on that we need to identify? And if there's not, there's not. We just need to develop some better coping skills and have open communication and have practice makes perfect moments for that. But if you perpetuate the self shaming part of it, then that's a slippery slope. Because the child is less inclined to engage in that conversation about what the feelings were that led up to that. And that's not what you want, because it'll manifest in so many different ways with friends and with teachers. So the shutdown mode is common, but we really want to allow for that open track of communication to say, let's go through the steps that led to this. But that's what BCBAs and counselors are so good about doing, is to identify the precipitating factors. And when you hear the way that they describe it, you're like, how could I not think of that? How did I not think of that? Just because they see it in a whole nother light. And then they'll talk about, for instance, an extinction burst. And it's all research, kind of rat research initially. But that's when, and we do it too. So we up the ante on our behavior to kind of get what we want. And once we realize that that is not going to lead to what we want, then we kind of acquiesce,
Yeah.
because it's just not going to work. And that's what BCBAs are so good at doing, is that they figure out how to get to the part where, okay, this child knows that this behavior is not going to get them what they want. And especially for kids on the spectrum, is that, some of that is inflexibility, and they up the ante on what they say. And it's not necessarily that they mean what they say. And it might be extreme comments. You hate me. I hate you. That kind of stuff. They don't mean that. They're trying to get to the point where whatever it takes to get that reward in getting what they want, we have to make sure that either that threshold is very, very low, because we don't even want to see this, because it
Right.
everybody around. If you can lower it, great. But if you realize time and time again with practice makes perfect that it's not going to get you what you want, let's figure out another way from a menu of options, so to speak. Now, for kids with ADHD that also have impulse discontrol problems, and that's just, in my opinion, a lot of that is very neurochemical. They don't have a lot of full control over that. And the perspective of a child. If you're talking about like a 10-year-old kid, they have perspective on Earth. I'll give them like 6 years maximum. So you're asking them to solve some of the problems that we still have in our daily social world, things that we could have never anticipated someone saying to us or doing to us, or we had the best of intentions, but it was, misinterpreted to such a degree that we got some sort of diatribe and, whatever it might be. And we're asking someone who has had 6 years of awareness on this earth to figure it out for themselves and not do that again. So the better, I think the better way of handling it is to figure out that antecedent piece
Mhm.
So we can then better understand the behavior and then we'll use the consequences that are more meaningful.
And sometimes it's simple. Sometimes it's like they're hungry,
Yeah.
or they're tired
Basic
and
life
they
needs.
just
Yes.
they're not self-regulating. I had a friend once, she, like, painted something on her wall. I'm gonna totally forget what it was, but it was something like, "Are you hungry? Are you tired? Are you" it was like it was an acronym, and she kept it on her back, like, on the wall of their kitchen, like, painted, 'cause she would just point. She'd be like, "Which one? If you're acting like a crazy person, tell me which one it is behind me," which I thought was so great,
It's
but
so concrete. Yeah.
let's shifting gears a little bit though. So this is so under talked about, and I'll kind of just throw, I guess, my own family under the bus here when I say this. I have 3 kids. I have know for certain 2 of them have ADHD. Now, I think the third probably does too. Actually, wait, no. According to you, she does. Yes, no, all three know. Okay, so all 3 kids have this, we'll call it neurotypical, thing that half the world is apparently supposed to have. I mean, every third person you meet is like, "Oh, I have ADHD." And it's so overused at this point. I think, anybody who just like has a hard time self-starting in the morning now is like, "Oh, I have ADHD and I need medicine." And it's overused,
Yeah.
but if you actually have the condition, it does create a pattern of, heightened emotions, behaviors that are problematic in the household, impulse control, changes with, dysregulation when you're going to do new things, or like you throw a new idea out or they're surprised by something. Um, and for that reason, parenting people like that is hard. It's harder than just the average little Tommy and Sally that go to school, do their homework, come home, make their bed and go to bed or go to sleep, and are not causing that just consistent, I'm looking for the right word here. It's almost like just it's like fire in the house, It's like there's embers always burning, and all it takes is like a little extra smoke and or air, and it's like it's ignited,
Yep.
and you're constantly seeing that over and over and over. And let's take a mom who might be listening, who's like, "Oh, that sounds familiar," in my household, because for whatever the reason, this does tend to be, in my experience at least, totally genetic. And if you do have one kid with something extra going on, the chances are very high that you've got more than one. And it might look totally different. It might be, this child is ADHD hyperactive, but the other is, the kind that's super calm and you would never see it coming. But I guess my question is, you're dealing with that, okay? And then let's say your spouse gets a bad illness, a cancer diagnosis, something like that, or one of your parents gets a long-term illness diagnosis. And all of a sudden you're trying to manage something that is life-threatening, and you're dealing with a lot of grief that comes from that. And you're also dealing with this kind of like household that can be amazing and warm and loving and crazy and great, but also emotionally chaotic. How does a person manage that? I mean, like, if you are the professional and you are dealing with a mom in your office who may or may not express her own, frustration and fears about how to handle a particular diagnosis with her kid. But what about when she's got something serious going on in her own interpersonal life too, and she's a caregiver already for somebody else? Like, what is your advice to a family like that? Like, how are you supposed to just white knuckle it and get through? Um, and survive that, because it lasts a long time, and it does add a layer of anxiety and pressure on you as a parent and as a person. I mean, I love my kids. They're all amazing. I wouldn't trade them for anything in the entire world, but they are a lot sometimes. And I'll tell them that, I'm like, you guys, you guys are extra, I love you. Like, your gifts are what make you so remarkable, but damn it, if
Yeah.
it's not hard being your mom sometimes.
Yeah. Yeah.
Thank God I'm not dealing with a major health crisis right now of my own or of somebody else in my family, but for 13 years I was. And it was really hard to manage that. And I think that's what puts caregivers who are in this club sandwich generation at such a higher risk, because you are dealing with so much at one time.
I'll give you 2 examples that resonate with that. Um, I see 2 kids of the 2 kids of this one family, and both parents are professionals and have demanding jobs, and so one of the parents, um, takes on a lot of responsibility. It's her parents who are both diagnosed with a form of dementia. One's Alzheimer's and one frontotemporal dementia, which is that in of itself is very, very,
Both both of them?
yes,
Oh, wow.
very, very challenging. And trying to, run a division at a university and trying to help her two children who have dyslexia, dysgraphia, ADHD. And what you just said, the little girl has the inattentive subtype, the boy has combined subtype. And not only is it caregiving for her parents are in the Northeast and she is in Tennessee. And the frontotemporal piece of this leads to a lot of dysregulated behavior. And so attorneys are involved. And I mean, there are just so many dynamics that this one mom is trying to manage. And I think that two things come to mind with her case is that you're such a high level individual and you're so used to be able to you're used to being able to tackle anything that comes your way. You have a doctoral level degree, you run a division, you have people under you, you delegate things, you're just kind of top notch, you're a great mom, you're a great wife, you're a great daughter, and all of these things start to become more of a succubus of your time and emotion, and not that you wouldn't have it any other way because there's obviously the privilege of being a caregiver and that mindset, but there's not enough hours in the day to get it done. You can't
Mhm,
be in two places at one time. You can't have those two huge demanding responsibilities for your family dynamic and be successful in your career in the moment. So I'm always a proponent of you can have everything. You can have it all, but not in the same season. So you kind of have to figure out, who can I get to help me? Who can I be vulnerable with? How can I let a counselor help me have grace for myself?
mhm,
How are my resources going to be divided between the expense of 2 days a week dyslexia therapy for both of my children, having to go to the psychiatrist for ADHD medication and having those every 4 week appointments because it's a controlled substance, having all of these demands for your children and making sure they get to school and their soccer and their basketball and their baseball and all that, and having your demands with your family in the Northeast, being able to figure out the flight scenario. How am I going to get there? And when do I need to get there? And if there's a last minute change, honestly, I don't think anybody would do that well. I don't know how anybody could do that top notch in all of those particular seasons that have happened to come at the same time. And so my advice, they're twofold, is definitely taking time for yourself and respite for yourself. And there is no shame in doing that. And that can come in the form of massages, that can come in the form of a counselor, virtual, if you've got 15 minutes during your lunch break, however you can fit it in. But it also comes in the form of, I hope you have good friends. I hope you are vulnerable with your friends. I hope that there's a text stream of, how do I get, this kid to soccer and this kid to baseball? Are their parents going to either one of these places? Can I have you pick up my child? Can I have help here? And organizations like yours, how can we access respite care in a way that doesn't feel like I'm pawning off my responsibility to my family members and my career? This particular parent continues to do everything, and I think she is doing it very well. But I mean, I can't imagine that she gets more than a couple of hours of sleep a night. And how sustainable is that? I don't know. And I think everybody is their best baseline. Just because research says that you need this and this and this, or that, if you don't do 3 days a week of dyslexia therapy, you're really going to fall behind. You do the best you can in the seasons of life that you find yourself in. But the counseling piece of that and the vulnerability and asking people to help you are the two primary things that come to mind. That's also with my other case of a mom who has a parent with dementia and a child with autism who is being bullied at school. And it is, Liz, you can't even put this in your mind's eye how this actually happened to my patient. And we're advocating as much as we can, but the additional overlay of emotion, how this child was treated at school and the target that this bully made of him. And when you target a child with special needs, that's a special kind of deviant behavior. That is not
Mm.
a boys will be boys or an impulsive action. It was premeditated, targeted for
Right,
someone presumably weaker than this
right.
predator.
And that's typically who bullies go for, right? It's
It is
always
just
somebody. Yep.
it is just it defies all logic because this child is my patient, and he has been welcomed into 4 different groups at school, and they have morphed a program to allow him to participate, keeping his headphones on, keeping his special hat on, helping hold the flag, when it's just amazing what they have done. And this one instance, not only was it traumatizing for my patient, but what do you think that mom has,
Ugh,
in addition to the emotions already surfacing for her parent and her 2 other children who
yeah.
are typically developing in all sports and all activities at school and youth group and just so active. And now the child with autism has been bullied to the point where we're all going to court.
Oh,
That
wow.
overlay of emotion, I don't know what you do with that, honestly, except to try to compartmentalize as best you can in the moment so that you're present for your other 2 children and you're doing what you need to do behind the scenes to be present for the child that isn't able to really get the verbiage together to describe all the feelings, just that I don't want to see the bully again. Yes, that I value that. So if that's if that's what you need from us, that's what we're going to do behind the scenes for you. But to also be present for the parent with dementia. Like, I don't really know the right answer to all of that except for counseling, being vulnerable and asking people to help you. Hopefully, you have great friends and other family members who are contributing, and then trying to access respite care in some way. But it is so expensive. Every piece of
Yeah.
that puzzle is expensive, and time is a luxury. Like,
Yeah.
you can't say that, "Oh, I've got 3 hours to do nothing." That doesn't exist when you have
Mm.
all these other demands. So it's always either you're not actively engaged in some responsibility in the moment, but it is, I'm constantly thinking about this. I'm
Mhm.
constantly trying to make it better in my mind. I'm trying to figure out what the um, next responsibility is, or how I'm going to manage when the court date comes. Like, all of these things are constantly ever present. And that in and of itself can impact your ability to manage anxiety and mood regulation.
So that's what happens. That's what happens. And I think so much of what you just said while you were talking, I was sitting here going, that was my life. Like, that was my life for so many years. And I just wrote a book. I don't know if I told you that.
Okay. Yeah.
And I've been in the process of kind of like going back through and really doing those like final edits,
Right.
not final edits of how it's going to be in the world, but like final edits before it is with an editor. And it had been probably 6 to 9 months before I was really like in it. It's been a long time. And when I was rereading it, I was just like amazed at the amount that I was juggling on my shoulders. And it was like, I don't know how else to say it except to say I was spellbound by how did I do that?
Mhm.
How did I do that? And the truth is, I wasn't. I mean, I was on the outside, I was going through the motions and I was doing everything, but I was a shell of myself. I mean, I was such, it would reach a place where I'd be like with my mom and I'd be trying to care for her. And we would have, there were good days and bad days, right? And the more good days she had, the more time I wanted to spend with her because it was like, oh, well, that was a good day. So let me come right back tomorrow and get you all day again. And maybe we'll have another one. But obviously, that wasn't what would happen. But you trick your brain into thinking just because you've had one good day, oh, I'm going to have another one. And so the harder the fall is
Right.
the next day when you go and you're with them and they're worse. And so you're on this like continuous emotional roller coaster of hoping and praying for the good. And when you get it, it's great. But when it's bad, it's like really bad because you were on this high and now you're on this low. And you throw into that the chaos of kids' sports multiple sports, multiple kids, multiple school teachers, multiple schools. I mean, in Nashville, at one point in time, I had all three of my children in a different school.
Oh,
There was a preschool, there was an elementary school for one, and then there was an elementary school for another. And then by the time I got them both into an elementary school, it was like time for one to move on to the next and, to go to secondary school. So it was a constant season of moving parts, of getting to know new teachers, of getting to know new parents, which, like, if you're listening and you're anything like me, there is nothing worse than having to pretend you like some Karen that sucks because you want little Timmy to be, asked home by their little asshole son, Bobby, It is the actual worst. And also, like, when you're going through that season of life that's hard, you have no fucks for that, You'll just be like, "Karen, I don't like you. We're never gonna be friends, but could your son just please be nice to
yeah,
Bobby
yeah,
because we're
yeah.
new at this school
Table
and,
that. We want this.
whatever." Like, I just remember it being such chaos,
Yeah.
and you're trying so hard in the middle of that to, like, enjoy your children
Yeah.
and enjoy your life. And I think the real hard part for people who are listening is when you are in those seasons and your life is nuts. You've got 3 kids, 3 schools, or 4 kids and 4 schools, or however many kids you have. Maybe 2 have ADHD. Maybe 1 is autistic and on the spectrum. Maybe 1 has nothing going on and is staring at you half the time going, "Can't you get these other guys together? And hey, I'm pretty great. Pay some attention to me
Yeah.
too."
Mhm.
These are all, like, just such drains
Yep.
from a mother and a father too. But, like, let's be honest, moms a lot of the time are taking a lot of the brunt from some of this stuff. But you're managing all of that and you're trying to care for aging parents. And if they're sick and dying, grieve at the same time. And it is too much. And then the truth is, I could get any expert from across the world on this podcast to say, here's the things you could do to manage these things: self-care, massage, therapy, whatever. It's all bullshit. Yes, you should do it, but, like, nothing's going to take away the hard
Yeah.
that is that season of
Yep.
life. And I think if I can provide any sort of hope to our listeners, like, the key is it's going to pass.
Yeah.
You won't always be in it,
Yeah.
but it doesn't mean that it's not just incredibly hard
Yeah.
while you're in it. And if you're listening right now and you're in it and you are feeling this way, I just want you to know you're not alone, number one. But number two, it's going to pass and there will become a season of life that can become for you again. It might take a decade, might take 15 years, but it's not always going to feel like this heavy
Right.
to carry. And I think involving people like Dr. Richie is really where the rubber meets the road in terms of making the big difference in how you're coping with a lot of this stuff. Because if you have a kid that you don't really know what's going on and they are getting bullied or they're coming home with anxiety or they're having sleep disturbances and you don't understand at least what the problem is, sometimes that in and of itself can create more anxiety and more worry than just knowing what you're dealing with. Am I right?
Yes, absolutely. And you said it best too, and I hate to quote Taylor Swift, but like Band-Aids don't fix bullet holes. That's
Yeah.
the God's honest truth. We're trying to do the best we can, but it's never going to be enough.
Mm-mm.
And different people feel different things about all of these situations, and you want to value that too. So I agree with you, but if there is something that we can do to solve some of the issues or answer some of the questions, and through, what I do is you said it perfectly, is just like kind of ADHD is the hip thing to have, so to speak. If it just comes from subjective rating scales, I don't really trust a lot of that diagnostic, because you have to look at so many other things that the brain does to allow you to pay attention or to allow you to organize, mentally organize, tangible, pieces of your backpack or your folders. Those things, is it atypical for your age and being a boy or girl? There are gender norms too that boys get away with a little bit more inattention and impulse discontrol. That's just the frontal lobe development. But there's so many other contributors to the execution of things. And so if you're not able to really pinpoint, because just to say that you had the subjective rating scales that the parent fills out, the teacher fills out, and then you get treated for ADHD, but there's still something really going on here that just didn't solve everything. The assessment piece is what you use to kind of use normative data at objectivity and say, hey, I got no dog in the race over here. It is truly, is this atypical for a 7-year-old boy in these realms, or what are our strengths that we can really capitalize on. And then how do we build the areas of weakness, because we know we can build that. Your child's brain is still malleable. You still got all these amazing connections being developed, and if we can really harness that and develop in it in the right way, some of that load of uncertainty, especially uncertainty about the future, or the load of having all these little bitty fires to put out at home, can go a little bit better because you have answers to a lot of those questions.
Right. Right. And support tools in a perfect world, you can afford these therapy services that help you understand how to better navigate and relate to your children. I
Yeah.
mean, one of the things I found that was crazy, it took me 3 kids to figure it out. But by the end, I went through Hunter had tantrums, obviously normal, whatever. Madeline kind of didn't in a way. It was weird. It was almost like she threw one or two and was like, well, that was undignified. I don't think I'm going to do that again. I'm so sorry. Typical girl. And then Gaines comes along and like, instead of, I remember my first pediatrician in Memphis telling me that I should actually get a car seat and put it in my kitchen. And when Hunter started freaking out and having tantrums, that the best thing I could do would be to strap him in a car seat until he calms down. And I think I maybe did it once and I was like, this is terrible. Like, no, I can't do this to him. Like this is not, he looks like he's freaking out even worse. And of course he was. Understandably. I mean, this is like why guys don't always listen to your pediatrician. You got to go with your gut here too. But um, as a new mom, of course, I didn't do that. But I think by Gaines, I will never forget this. Maybe like the third or fourth time he had a real tantrum, in the twos, threes. It's really more threes for boys. But I did something crazy. I just was like, what would I want somebody to do to me if I was just losing my mind, freaking out, couldn't control myself? Because that's essentially what's going on with a tantrum. And I just walked over to him and I put my arms around him and I hugged him. And I said, it is so hard to be 3, isn't it?
Mhm.
It's so hard. This is hard. You want all these things, and mommy and daddy are saying no, and you're frustrated. I know that's hard. I mean, it dispelled that thing in about 15 seconds. I mean, to watch him calm down so fast like that. And I think that's where all these therapies and people that can teach you how to handle, because obviously, if you've got a highly, either very on the spectrum kid, level 3 or whatever, or a behavioral problem, or, ADHD with impulse control or what have you, and you've got a preteen, let's say, especially a girl preteen that might be like hormones ablazing too at the same time, and they're having a freak out, that freak out looks a lot different than a child, a toddler. Then it's not so easy to fix with just a hug and a pat on the head and here's your sippy cup and why don't we go curl up and watch the Wiggles together? I'm aging myself, by the way, by saying Wiggles, but whatever the show is,
Yeah.
that your kid likes, it's very different.
Yeah.
And you can't expect to get through these things without having some support by professionals that know what to do. But what about the people who can't afford that? That's really where I wanted to go next is if you're listening, you've got all this stuff going on. You've had a kid with a diagnosis. And I do tend to see, I'm in a graduate program right now, and we have these group calls, and like a lot of the people who have very neurodevelopmental kids, it's multiple. And, what do you do when you're in that boat and you cannot afford social pragmatic therapy, speech pragmatic therapy,
Occupational therapy.
OT,
Uh-huh.
speech therapy? I mean, there's all these different ones, or cognitive behavioral therapy, even just for the kid and the family. And then you've got the family counseling that needs to happen. Like when you can't afford all of that, what are you supposed to do?
I think sometimes, and I say this with a lot of grace too, is that I think public schools do the best they can with the resources that they have. So I mentioned a public school before that has a social communication group and a social skills group in house. And that's not required, but they wanted to have that part of their social emotional learning curriculum, SEL. And it's kind of like navigating your world and seeing who is in charge of things and asking them, what do you do for this? You can get an IEP, of course, but sometimes people don't know to advocate for a functional behavior assessment, an FBA. And so that's when a behavior therapist of some sort, a lot of times it's a BCBA, but sometimes it's a school counselor, somebody that watches that child in every area of the school, structured and unstructured. So you have, what does it look like in unstructured time on the playground? Or what does it look like in unstructured time in the cafeteria, which can be really loud for a child on the spectrum who has hypersensitivity to noise.
Sound.
So
Oh.
they look at it from a very structured behavior standpoint and say, these are the things that we want to identify we want to make this happen more, or we want to make this behavior happen less. And this is the way we're going to do it because that's what a behavior specialist is great at doing. So at least in those 8 hours a day, you can start to see with the FBA first, which then informs the behavioral intervention program, BIP. You can have that on the IEP and say, I get the speech language therapy for the language pragmatics piece, which is impacting my social emotional development. Because some people will say, well, we're only doing speech language therapy if it impacts you in the classroom. I don't know how you really separate that. I don't know how you separate a child's functionality in the classroom versus everywhere else at school. And so
Hmm.
these are the things, in my opinion, to kind of argue against and saying, well, communication is ever present. If we're having difficulty using our language to functionally and socially communicate, that is a target for the school to either provide speech language therapy services or that social language pragmatics group, or to advocate for there to be one developed. Also, in the community, Autism Speaks is a really good website to identify groups that provide access to services. Insurance companies, sometimes you gotta have to like browbeat into submission. Tennessee passed the Autism Equity Act several years ago that makes certain that autism treatment is treated like any other neurological disorder treatment. So it's any other neurological disorder like seizures, epilepsy, you have to get the services. And a lot of times that will be speech language therapy, occupational therapy, and behavioral therapy. And, cognitive behavioral therapy, I think, important as a rule of thumb for if you have that rational thought and can discuss all of your thoughts about how that situation went down. A lot of times kids on the spectrum don't have a lot of the verbiage for that,
Hmm.
or they just want to shut down and not talk about it. So how do I get it that sometimes it's play therapy? Sometimes it's more of a BCBA helping the parents help the child function better, helping the
Right.
teachers help the child function better. For ADHD, a lot of organizations are available for executive function support. I just did a presentation at Vanderbilt 3 weeks ago on executive function, just the practicality of it and what it looks like. And I have my slides available that I can share with anybody. And it has a lot of resources in terms of, book resources, website resources, talking about what it really is. It's not just attention concentration. There's so much more that goes on behind the scenes. So really educating, I think, yourself about that and reading some of these books and trying to do as much as you can at home. But also, if it's a public school, ask for the 504 plan to have these
Ask for
accommodations.
help. Yeah.
Yes.
Push
And
for
a
the
private,
support.
yeah, in a private school, even here, one of my dear friends is a middle school learning specialist, and they have an executive function group. They do like, I think it's 6 to 9 weeks. I can't remember exactly, but they work on a different executive function every week. And then she sends home the information to the parents, say, hey, this is what we worked on. This is how we discussed it. This is what you can do at home. So again, the generalizability of learning something in a counseling session or learning something in kind of a studious mode, that doesn't always generalize to the remainder of the week. And again, if the child only has a few years of perspective of life,
Right.
is this the situation she talked about? This doesn't look exactly what we talked about. Is this what I should do in this situation? So it's helpful for the adults to kind of guide all of that as well. There's in social skills therapy, for example, there are social skills therapists that take insurance. There are 10 care recipients that are accessing the social skills services. And what's so great about social skills therapy is that they make a lot of these things that we're talking about in a kind of an abstract format. They make it so much more concrete. So what you
Mhm.
said that your friend did, hungry, sleepy, or whatever it was, that is like the concrete representation of whatever that feeling is. And
Mhm.
that's what a lot of people need to say, I don't necessarily have the verbiage in the moment because I'm really stressed out or my communication skills aren't where they need to be. So some
Right.
social skills therapists use these things called the unthinkables. And my favorite is rock brain. And when you feel like rock brain, you're stuck. Nothing's going to move you. You can't get out of your own headspace. But this is
Mhm.
what you do when you feel like rock brain. So it's this concrete nature of explaining these emotions that all of us have. I mean, everybody got something. So all of us have these emotions that we need to make sense of. And if we need to have it more concrete, that's a way to do it. But it's not forever. You don't have these therapies forever. And that's also
Right.
what you were saying too, is that it is a temporary situation. And
The
but
season.
yeah, exactly. But also, if you graduate from this goal in speech language therapy, that doesn't mean that there's not another goal because you're constantly evolving and more is being expected of you. But for the
Right.
interim, just trying to find the groups and the services that can help you access what it needs to be if it's not going to be in your public school system. But the caregiver aspect of that, there are a lot of support groups for executive function and autism spectrum just designed for parents and other caregivers because a lot of the times it's a grandparent who's caring for that child. And they're in a whole nother season of life, often with their own medical problems, trying to care for a grandchild that they didn't have a lot of knowledge of this back in the day. Even though
Mhm.
Donald Gray Triplett was diagnosed in the 40s, we really didn't start to talk about a lot of this until about, in my opinion, about 20 years ago. So,
Oh, that brings me to another good question.
yeah,
Hang on, I have to interject and
yeah,
ask this, or I'm
mm,
not going to get time
yeah.
to. Um, this is going to be great clickbait, guys. Anthony, if my producer is listening, you're going to love this for the clip. But all right, I got to ask it. Is there more autism today, Dr. Richie, than there was in the past?
I just don't think that that is the way we need to think about it. What we've seen over time is that more people are presenting for diagnostics and assessments. More people are recognizing that it is a spectrum and not just someone who is nonverbal and exhibiting the typical signs of what we used to think is autistic disorder. We see it as a spectrum and we're presenting for more help. And so now, especially insurance companies are covering speech language therapy for social language pragmatics, and they weren't before. Some still don't, but the availability of these services and people talking about it because it's not kind of a hush hush closed door situation, and
Right,
recognizing that so much gain and progress can be made with presenting for an assessment and being diagnosed and accessing the right avenues. The navigational roadmap is narrower because we know what is going to work. Is it going to take
right,
time? Absolutely, but it's not necessarily that it's plentiful. It's just that a lot of this was behind closed doors back in the 70s. It was always there.
right.
You just didn't. And even if I think back to, I'm a public school kid. I'm for public school, and we had more of an inclusion mindset, even in small town Mississippi, that I absolutely adored. Some of my dearest friends, we would have everybody at our birthday parties. We would make sure that everybody was included, and we sat with different people at the cafeteria table. It was just I go back to say too, we had the Ellisville State School, and that's honestly where all of this started. You asked me where this started, and if you see my website, sarahritchiephd.com, I start with the story of how I started playing piano at the church service for the Ellisville State School. And back then we called it an MRDD facility. Now you call a facility for people with intellectual disabilities and neurodevelopmental disorders that can't live independently. But they also have group homes to help them live more independently. So it's a wonderful organization. And that was early 1990s that I started doing that. And so I would play the piano because the pastor was my preacher at church. And he's like, "Hey, you want to come play the piano for this?" It was a room of 60 individuals, obviously autism, obviously genetic disorders like Prader-Willi. There are so many reasons why these individuals, and they're all adults, have a need for this program, but to celebrate and have a church service, have outings. Everybody was welcoming in the community. And so I had this one guy that every time after I finished, got off the piano, he would make me take my shoe off, both feet sometimes. And then he'd put a piece of paper under my foot and he'd trace rapidly around my foot. And that was his fixation. Did I know that he was on the spectrum then? No, but I do now. And that's in the early 90s. It was always there. People are talking about it more. People are
Mhm.
willing to be vulnerable. People
Yeah.
know that services are there and they want their children to have the best life possible. And the only way you start that process is to access the services and know what the right services will be.
But so many people are afraid. They're still afraid. It's so funny to me how similar autism and Alzheimer's are in not the way they present themselves, of course, or just obviously the duration or course of lifetime with it. One's a terminal disease, but the way that society thinks about each of them is very similar. You say that word Alzheimer's and immediately the gasp is heard or the internal sinking is there because you just realize what you're going to be dealing with. But I also think for so many families, you say the word autism and they experience so much fear and uncertainty. And I can remember when my daughter, before she started like grade school, and she was starting in public, and they wanted to like get her just speech services. She was like a little bit delayed in her speech or had a lisp from thumb sucking, actually. And I just remember when we did the testing through the school, I remember walking into that meeting and the guy just had a weird look on his face. And for whatever the reason, he was acting like strange about not knowing, what he was dealing with Madeline in her speech. And I never will forget doing this, but I was like, well, what do you think it is? And like, I just had this sense of like panic.
Ugh.
And I think that that's how so many families feel,
Ugh.
when they're given this autism diagnosis. It's like, well, it can't be that way. What does that mean for my future? What does it mean for their future? Am I going to be taking care of this kid forever? Or are they ever going to live on their own? Are they ever going to get married? Are they ever going to have a life? And there's just this fear
Yeah.
that's associated with the diagnosis and a stigma of not wanting to deal with it and not wanting to experience that. And unfortunately, the parallels between that and Alzheimer's it's eerily similar,
Yeah.
in my mind,
Yeah.
I think.
Yeah.
I think for so many families, that's really the underlying just current that lies through both is just this fear that you don't know what you're dealing with exactly. But with all things, so much has changed in the world of autism just since since I was born and I was coming up. I mean, same as you, I was a public school kid.
Yeah.
There were a few kids in my grade that like were a little different, but I didn't know what it was. Looking back on it now, I'm like, that
Yeah.
kid was probably on the spectrum. You know what I mean? And they probably just weren't getting the support that they needed. But I think it's so great that in the last, 20 years, we've been able to kind of pull back the mask a little bit and have so many people be willing to share what their lives are like. I mean, if you open Instagram, there's 1,000,001 pages of people who are like, I'm ADHD, I'm ADHD, I'm level 1 autistic, I'm level 2 autistic, and this is how I'm experiencing life. And just giving people a glimpse into what it looks like and what it feels like. And I think, as all things, right? Knowledge is power.
Yeah.
And if you are one of the people listening that I was talking about and you can't afford all these special services, I would say the first thing you should do is get in touch with your state, and figure out what's available for free, what's available with your insurance company. A lot of these places are private pay. Some of the best maybe in your city are private pay, but that doesn't mean those services aren't still available by your state and by government, local agencies. And it might not be as good, but it's better than nothing. I have loved talking to you. I could do it
Yes.
for 2 weeks straight and still not pull everything out of you that I wanted to. But I know Nikki's going to want to have you back when she can be here because she's got 2 kids, and well, really, her whole house is neuroatypical too. So
Fun
she's
is what it sounds like
but
to me.
it is fun. It is fun. I mean, really. And I mean, I can already see it now in my 18-year-old, and he had the worst. I mean, he was so hard from 10 to 12, and I know that ADHD was not treated, and there were so many like loud outbursts and moments where I was just banging my head going, God, am I doing the right thing with this kid and whatever. He is amazing. He is amazing. He has literally gotten himself like an almost half ride to an amazing college. He is the most delightful person that I can possibly spend my time with. I love him so much, and he's so, so great. And that's where I say, this is just the season. And these neuroatypical kids, when they grow up, I mean, there's just no greater person. They're more creative. They're smarter. They're more fun, and it's all going to be okay.
Yeah.
So thank you for coming on the podcast today. I really, really enjoyed my time with you.
Yes, me too.